Hey guys, so in our last video we discussed why it's important to have a strong core and a contracted core. Today I'm going to tell you a little bit more about the core muscles. So a lot of people think that if you've got a six-pack or if you've got strong abs, it automatically translates to having a strong core. This is not always the case. The rectus abdominis, which is your six-pack muscle, is actually a superficial muscle. It's responsible for trunk flexion as well as hip flexion. Your core muscles are deep muscles that are attached to the spine and to the pelvis. And they include your transversus abdominis, your internal and external obliques, the multifidus at the back, and your pelvic floor muscles. A few tips to ensure that you get proper contraction before you start your workout. First, try to maintain a neutral pelvis. So don't allow too much of anterior tilt or too much of posterior tilt. Find a neutral position which will allow you to have a good natural lumbar lordosis or lumbar curvature. Secondly, you want to pull your rib cage downwards without flexing your spine. So neutral pelvis, pull your rib cage downwards, which is going to engage your abs and make it feel solid. And then place your fingers on your flanks and give it a bit of a squeeze. And from here, increase your intra-abdominal pressure, which will, as you do that, it pushes your obliques, push your fingers outwards. From this position, your core is now contracted and you're ready to start your workout, because this will ensure that you still have trunk mobility, but it limits the movement of your spine. And also remember that you need to be able to breathe normally while doing this. Right? Then 3 quick exercises that are going to help to strengthen your core over time. These are ideal exercises that there's not a lot of movement of the spine that happens. They're quite easy to do, and the reason they're designed like this is so that you can do them if you've injured your back and you need to rehab it without too much of pain. So they're called McGill Big 3, and they're named after Stuart McGill, who is a back pain specialist, and I'm going to show the 3 exercises to you. So the first one is called bird dog, right? So get onto your fours, knees directly below your hips, and your hands directly below your shoulders. From this position, engage your core, pull your rib cage downwards without flexing your trunk, and then lift while keeping your core tight. Lift your right leg, push it out behind you, and lift your left arm, push that out in front of you. And don't allow this movement to rotate your torso. Keep that position, hold it for about 10 seconds, then relax, and repeat on the other side. Do this about 3 times, and that's your first exercise done. The second exercise is 2 variations of it. It's called the side plank. So let's start off with an easier variation. Start off with your elbow directly below your shoulder, your hips and knees and ankles on the ground, and about a 90-degree angle at your knee joint. From here, again, pull your rib cage downwards, keep your core tight, and imagine that there's a rope pulling your pelvis straight up. So push your knees into the ground, lift your pelvis. Don't allow your chest or your shoulders to rotate. Keep that nice and straight. Hold this for about 10 seconds. Repeat 3 times and on both sides. And the variation, the slightly more challenging variation of this is, again, elbow directly below your shoulder. This time your legs are going to be straighter. You're going to keep your feet on the ground, contract your core again, and again imagine there's a rope lifting your pelvis, but this time you're going to use your feet. Your feet are going to be the only contact to the ground. So push your feet to the ground, hold this position, don't allow any rotation. Hold that for 10 seconds and repeat 3 times on both sides. The last one is called the curl up. So the position that you're going to start in with this is with one leg straight and one knee bent. The reason for this is that if you have both knees bent, it flattens your lordosis and pushes your back into the ground, which is not a neutral position. If you have both legs straight, it increases your lordosis, and it's also not a neutral position. So with one leg up and one leg straight. You've got a neutral lordosis. Keep your one hand under your back to ensure that when you do this, it doesn't push your back into the ground or it doesn't increase your lordosis. You must keep that neutral spine position. Pull your rib cage downwards again and keep your core nice and tight. And from here, you want to lift your head and shoulders just a little bit off the ground. Hold that for 10 seconds and then relax. It may seem like it's quite easy, but if you do the contraction right, you'll feel your entire core contracting. The idea is not to have a lot of movement, it's just to have a little bit of movement, but to hold that position for at least 10 seconds. And try not to lift your shoulders too far off the ground. That is the McGill Big 3, which is perfect for rehab and core strengthening. And I will post a video of a few more exercises, but these are the basics that you can start with.